our wards became full, the ICUs became full. So that was the turning point. I'm Dr. Anil Grover. I'm a specialist in internal medicine. My biggest fear would be if people let down their guard, become less careful, and there is a second wave. So I would say just continue taking precautions as what we have been taking, because anybody can get infected anytime, but we have managed very well, I would believe. I must congratulate Dubai government and the Dubai health authorities. Excellent work. Dubai is, I think, one of the topmost safest countries. The good news is that most of the people who get infected, you can say maybe more than 85% will be mild and asymptomatic and 100% recovery. They don't even need to go to a hospital sometime. About 10% might have pneumonias or some lung infection. Again, a very good, almost 100% recovery. So only about 5% with the diseases or comorbid conditions will have some severe disease where you need oxygen or ICU support. And out of that also, most of them have recovered. With the mortality rate is almost less than 1%. So that is a good news. The challenges were, you can say, first was in terms of preparedness. So when we started, we made a COVID task force, all the team members, and we started to lay down protocols and procedures from the point of entry of a patient at the gate of the hospital till he's discharged. So that was challenge number one. And second challenge, you can say, once the patient we started taking in patients, since it's a new disease and new data kept on evolving, new guidelines kept on evolving. So the second challenge was successfully treating these patients with ever-changing guidelines, but again, successfully managed. And the third challenge, I would say, was to keep my team of doctors, nurses, paramedical, housekeeping, and my two sons and my wife away from getting infected. So this was another big challenge. These were the three challenges, I would say. Only wearing a mask will not be successful in decreasing the progression. Apart from mask, you need to continue social distancing. That is a distance of at least 2 meters or 6 feet. And number 3 is hand hygiene. So the hand hygiene, the social distancing, and effectively using the mask are the 3 main features. So, and in wearing a mask, you need to be very careful of the way you wear a mask. Your nose, your face has to be covered. You need not be touching the mask. It should be properly worn, properly disposed of. And even before you wear a mask, your hand sanitization. After you dispose of mask, the hand sanitization. So these are the practical tips.